Welcome back at 8:22. New federal rules are meant to make medical records easy for patients to access, but whether that would actually work remains to be seen. We get more details on those new rules and the roadblocks from Paul Seegert, managing partner at PCS Advisors, a health benefits consulting firm. Good morning, Paul.
Good morning. Thanks for having me.
Yeah, of course. So I'm excited to talk about these new rules. I know they took effect just days ago. They stipulate healthcare organizations that they can give what's referred to as unfettered access to full health records for patients. This is advertised as something that would cut out delays, printing charges, and really anything associated with that added headache for patients. How is it going to work?
Well, the idea is that with all the technology we have today with our smartphones and everything else, that we should be able to access as consumers our electronic health records in the same format that providers keep them in, which is a really positive step. Implementation is yet to be seen. Oftentimes that's where these things succeed or fail. But getting consumers access to this information so that they could take it from one provider to another, from one system to another, and be more involved in their own care is a really positive thing.
Well, I mean, rule changes are one thing. It sounds like in theory a lot of people support this idea. Compliance, though, is another. Is this something that you see providers or other data holders to buy into, or do you foresee any possible hindrances with that?
Well, they've already pushed back. They've delayed it since April of 21. And if the hospital transparency rule is any indication of how this might roll out, I would expect that there will be compliance issues, in part because it's a big transition to make technologically for some of these organizations and administratively, and in part because the industry isn't eager to move towards more transparency. The hospital rule, as an example, was part of the original Affordable Care Act. And if you fast forward now, almost 12 years later, we've got in the 3 largest hospital chains less than 1% total compliance on that transparency rule. So I think we'll need to keep a close eye on it in implementation, but I'm at least positive about the fact that we're moving in the right direction.
So, okay, so let's say you're a patient. Let's say you need to look back at either blood work or imaging of any kind. What can you do?
Well, it used to be that you had one of 2 options. You could either go onto your online portal, say with your health insurer, and look through some claims information there, some explanations of benefits and so on. But getting access to real medical records required, in lots of cases, that you had to make a request. They had 30 days to respond. It could be that you had to pay charges to get these things printed and go pick them up or have them mailed, only to find out they weren't what you needed. And it was a pretty clunky and old-fashioned process. The idea now is that you could make a request and have pretty immediate access electronically to the doctor's notes and your complete medical records, all the information about your care.
Now, with this all but certain sort of resistance that you've been describing, I mean, what's your best advice to patients who might be creeping up on that or encountering that as this rule is implemented moving forward?
Well, it is your information. You own it. And if you have some pushback around privacy, HIPAA as an example, that doesn't apply. It's your information. It just needs to be handled properly. And it can be very useful to a consumer. We've talked to consumers that stayed within a health system because the difficulty of getting their records made it so inconvenient. Even though they might like to consume healthcare somewhere else, they chose not to because they didn't want to have to redo testing and other parts of their care. This, I think, will help with that. So just keep in mind, it is your information, you own it, and they are required by law to provide that to you.
Yeah. All right. Well, Paul, we appreciate your time. We appreciate your insight, and hopefully this will help patients in the future.